Good to be back.
Well, it is. Welcome back, everybody. This is a impromptu episode, kind of an emergency broadcast, almost, I would say, but Ian's Boyz podcast, Neil and Ken. Hotline is 412-613-1116.
Don't forget our socials, our TikTok or Instagram. Or you can email us too, by the way, if we haven't mentioned it in the past couple.
The real Ian's Boyz at gmail.com.
That's right, yeah. Impromptu.
Ian'sboyz.com.
Ian'sboyz.com.
Merch.
All the stuff that's normal, but we got to keep saying it to drill it into your head so that you buy it off us.
It's a repetition thing.
Yeah, just like radio. You remember what radio? Do you remember radio?
I remember Radiohead.
Radiohead, sweet. Tom,
I remember
you got a fucked up eye.
Shit your pants.
I did do that too. It's because of his eye. I looked right into his fucking eye and I shit.
Tom's a real fashionista, if you don't know.
He is, yeah. Mm-hmm. Sorry, I'm sucking on this mint over here. This is a poor choice for a podcast.
So Ken has to apologize for almost dying. We're just gonna dive right into it because
may as well. Yeah, the probably majority of this episode is going to be about it.
We apologize for missing this weekend's episode, but Ken kind of had an issue.
Yeah, so
you can't blame us for missing.
Yeah. So we missed on the account of me literally almost dying, I guess. So
it was you were getting there.
Oh, I was real close. So in your heart, you have a couple major arteries. One's your LAD, right? That's the one everyone calls the Widowmaker.
Yeah.
Mine had a 70% blockage, and I found this out and had a procedure to go in and remedy that, intervention to take care of that. And I'm still recovering from that, kind of. I mean, it's pretty non-invasive what they do in this day and age, but I'm being mindful, so I'm not drinking, and I'm putting that quotation marks.
This is grape juice, number one.
Yeah. I'm having a little bit of red wine. That's just so I don't get the shakes. Okay.
Well, yeah, because then he couldn't operate the soundboard or anything like that.
I would be useless. Yeah. And to stop drinking alcohol that abruptly is more dangerous than my blockage in my artery.
To my knowledge, it's not really blocked anymore.
It is not. So what they did...
I mean, I'll drink to that.
I'll drink to that too. I almost was not here to continue this podcast.
It's honestly, I may have had to shut it down because I don't want to fucking do all the editing and stuff. Like that's not
it's not your job.
I bankrolled this operation.
Right. Yeah. I'm supposed to be doing all the labor intensive blue collar stuff. So
well, that's probably why you had this heart attack.
Probably.
You can't sue me though, because we're technically. Yeah, we're gonna have to talk about this off air.
We'll figure it out.
This is a little bit of a situation that I don't want to get out of hand, and I don't want anything on the record.
No, of course I understand that.
Honestly I don't know what the fuck I would have done. You're the other half of the podcast. I wouldn't have. And then where would I've come to get drunk every weekend?
You can still come here. I mean,
yeah, but I don't want to bug your wife.
I mean, I'll be here in spirit.
I mean, me and your daughter. We'll fuck around.
Yeah.
We'll break some windows in the garage.
No doubt. Yeah,
it'll be fine. It'll be cool.
Yeah. So it's a risk versus reward thing. Everything in the medical industry, right? Everything in life.
Well, let's talk about what they actually did to you, because there's a couple things that they could have done, right?
They could, yes. So this is what happened. Okay, I had some symptoms early on, or late as what would you say?
Well, you did have that one
as far back as like a month ago.
Heat stroke or that spell where you were dehydrated, which I think that had to have played a significant role in that.
Yeah,
had to have.
I think that now, like going back to that, like I think this has been an issue, and I've seen the ER a couple times in the past year, and now I think it was in fact related, but at the time I've been brushed out of the emergency room both times saying, "Hey, stop drinking alcohol and you're dehydrated," which is partially true.
Probably mostly, not mostly, but a contributing factor why it happened.
Sure.
If you didn't do that, wouldn't have happened.
Right. Yeah, exactly. So then I finally was like, you know what? I need to go and dive into this a little further. These couple symptoms I was having, not necessarily chest pains, but a little bit of lightheadedness from time to time. Maybe some chest discomfort, right?
You had some palpitations or something before,
palpitations, right? Yeah, exactly. Related or not, unknown. I would say yeah. But I'm no medical professional. At any rate, so I got into a cardiologist, and they basically threw the book at me and like, you know what? We're just going to give you every test because you have okay insurance, and we'll see if they allow you to.
I will say thank God for fucking. Imagine if you didn't have fucking health insurance, bro.
Oh no!
And that's the thing people don't understand is like,
I probably
could have bankrupt you.
Yeah, well, not only bankrupt, but if I didn't have it and I didn't go because I didn't have
you'd have been dead.
Probably within a year's time or so.
Yeah.
Give or take. It just depends on my level of exertion or...
Depends on when you stop drinking.
Yeah, right. Yeah, you can't do that.
We were discussing earlier.
Yeah. Yeah.
I feel like I have to lube up now.
Yeah, just to be safe, yeah. So, at any rate, they threw a couple tests at me, right? So they did like a Holter monitor, 14-day monitor. They did an echocardiogram, right? That's where they do like a, for the baby, the same thing they do with the baby. I forget what they call that.
It's
shit. Doesn't matter. It's where they use the gel on you and...
Ultrasound.
Yeah, very similar anyways.
They just wanted to make sure he wasn't pregnant.
Yeah, he did. Yeah.
Because he had that bottom surgery. Maybe
they did ask me if my preferred pronoun was man multiple times during this whole process, and I was like, I'm dying. Can you fucking fix me?
I was going to say, number one, completely off topic here.
Yeah.
I'm dying. So let's address that first before my fucking pronouns.
Yeah, we'll go on to that later as far as my pronouns.
Obviously, this man is sitting here with a beard.
Yeah, right.
Like full on.
Come on. Yeah.
I don't want to be that guy, but I think I can assume gender pretty good.
Yeah, right. Yeah.
And if it's ambiguous...
Plus, look at my broad shoulders and strong chin line. And
man, because I don't know.
I mean, come on.
That could be like, you could be on hormones. You could be a FTM, you know what I mean? You could be. And we all could be, technically.
Moving past it.
With enough steroids.
Sure.
You know?
So, they did a sleep study, right? Mm-hmm. And they put in an order for what's called a cardiac CT. It's like a CAT scan.
Yeah.
But they use a dye. Okay. So that was the one. She was like, you know what? At your age, they're probably not going to let this happen because the insurance company's not going to pay for this.
They're not going to prove it. Yeah.
Right. So I was like, whatever.
It's a procedure you're 30 something years old.
Yep.
That's not what's wrong with you.
Correct. And you know what? That's most of what medicine is. You have
to follow I hate to be that guy,
That's how it goes. I mean,
I don't want to assume what's wrong with you. Like I would assume your gender.
Right. Of course. But it's like, even me as being a mechanic too, you kind of, why would you not go for the most common things first?
Yeah. The standard diagnosis. If you have these symptoms, usually it's X.
And if it stinks like shit, it's probably shit. That's just like...
If it shits like a duck, it quacks like a duck.
It's
probably a duck.
Most likely. But
maybe.
It could be...
could be a goose.
Yeah, could be.
Could be a swan.
Neither here nor there. So these studies, or blood work too, they did, but these things are coming in left and right, normal. I get to the sleep study, and they said, "Hey, you're having 6 events per hour per night that you sleep. You're
not getting any good sleep.
Not necessarily good sleep. Well, definitely not good sleep, but my blood oxygen saturation dropped as low as 78% during those 6 events.
That's pretty significant.
It is, when it should be in like the 90s.
90s, yeah.
Mm-hmm.
And then when you're sleeping, it's maybe even a little less than that. I don't know.
Yeah, maybe, but still significally lower for my age and whatever. So I was like, this makes a lot of sense because...
That fucks you up right there. Like, people don't understand. Sleep it's so important.
Mm-hmm.
The older you get, the less important it is, I will say. But we're not at that age yet. That's like when you're 50-ish. Give or take.
Yeah, right.
That's when, like,
and that's you can
that's
be related.
Pretty standard. That's pretty standard.
Can be related to overweight, but they said I talked to a doctor a couple times about this. Not like that. Yeah,
you're not my 600-pound life where you can't sleep on your back.
You're closing your airway.
Crushing your.
Oh my Lord! Yeah. I eat an orange when I'm hungry for a snack.
A couple bushels, yeah. A bushel or two, but
So that was fine. We started progressing, moving forward in that diagnosis, which is still true as of this moment right now, but unrelated to what else is coming here. So the cardiac scan got approved. Okay.
Yep.
We had to tell them I was having chest pains. But to be full honest,
that you probably weren't.
I really wasn't.
Not weren't, but you probably were.
I was having discomfort.
Yeah. That's what I'm saying. It doesn't. It's not but that is a pain. Like that technically.
True. Yep.
What's your definition here? What's your taxonomy?
Yeah. No. Sure. So they got it approved. I did it. Very, very uncomfortable. What they do for that is you go in. They give you some meds the day before, right before, to drop your heart rate down real low. I had to be like around 40 beats per minute.
See, I don't want to steal your thunder, but I have a super low resting heart rate.
What is it?
Right now, I mean, I could tell my average is like in the low 40s.
Is it really?
Yeah.
So that's awesome. That's really good. So me, like mine is not.
I don't know if it's good because I'm so tall though. That's.
Oh, I don't know that. But anyways, had to be like 40 or below, right, to do this test. So they do that, and then you go on the table in there, and they will inject you with a dye, right? It's a contrast dye, and then give you nitroglycerin under your tongue. What that does is like
makes you explode.
Yeah, your blood vessels explode. Oh,
you really
Oh, it was awful. I had like an instant migraine. It was terrible.
Ken was hard.
Yeah, so they take picture. They're watching. Yeah, no, I was very soft. This situation was very uncomfortable. But they're doing a CAT scan of your heart, right? Your chest cavity, that pulmonary.
They're looking at essentially they're tracking the dye through your veins, and your arteries, your heart, etc.
Exactly. So that went, and that took some time because I found out that they send those results, and they sent my results anyways to Stanford University in California.
Somebody probably legitimately has to overview like whatever the time lapse is that they're looking at and say, that doesn't really look right there. Like there's a blockage here. You know what I mean? Like somebody who's reasonably trained, eventually they'll be replaced by AI. But
probably, but they sent it to college out there in California, which I guess they're renowned for this test out there.
I mean, the Ivy Leagues. I mean, they don't like the Jews, so I don't know if that really makes it right. You know,
I don't know that.
To me, that seems a little off. But
scary.
But they're the best, though. I mean, you can't deny it.
So then I got a call after they flagged my results, sent it back, and said, "Hey, you need to go in for a cath." Because after review, it looks that you have about 60% blockage in your LAD, which is that Widowmaker.
The Widowmaker, yeah.
I'm like, holy fuck, like, 'cause I don't feel that way. That's not like you would think you would feel that, and these tests sometimes can be wrong. That's why they have you going for exploratory cath.
There's multiple stuff.
Well, that's what the cath is for, because they were like, hey, it shows some blockage. Just verify if it's less than 50 or less. They won't do anything. They won't do any intervention. They might give you some medication and say, change your life.
Thinners.
Yeah, this is where you're at. Well, they ended up, I get scheduled, I go in for it, and they actually found 70% blockage. And they were, you have to have intervention.
Yeah, I was going to say 70% is like, you're really, it's like 70, 60% is that, really it's 60 is like, but 70 is like you have to do something,
right? This LAD,
from what I've researched,
yeah,
because every situation's different.
This supplies majority of the oxygen-rich blood to your heart. Majority of it. This artery. Either way, so
it's very important for your body to function,
right? Yes,
which yours almost stopped.
Well, apparently, yeah,
allegedly.
Yeah.
I didn't go in, and to be fair, I didn't go in and take a look.
Yeah.
So,
I did. I was awake the whole time.
I think it's kind of like when you go to a Jiffy Lube and they're like, yeah, you need a whole flush.
You need to get flushed
you
out.
Flush
we just want your insurance money.
We just gotta flush you out, dude. You were fine.
I felt.
I'm just kidding. No, I'm sure
kind of fine though.
But that's
the scary thing.
That's your baseline. That's the thing that people understand is health and how things happen. Like it's over time. Like you don't notice it. It's so
progressive
long,
and
you don't notice. Like it's.
Yeah. So they went in and they did what's called angioplasties, where they put about an 1/8 inch diameter cath into your artery.
Jacqueline did say that she was a little nervous because, and you were a little nervous because you thought they were going to have to go through your leg or your femoral
yeah, and the groin. That's two places they normally do it. Well, three technically, but
yeah. So they were originally going to do that. And then they were like, well, maybe we could do his wrist. And then when they started examining you, she told me that they actually went through your anus.
Oh, yeah.
Because that was like the easiest path that they could really get in there.
The fastest way to my heart is through my anus. So
well, that's what they said. I don't know, I'm not a doctor.
Hear that, Costas?
But that's what I heard,
Yeah. So what they do, that's right. The femoral, depending on the doctor, normally,
the anal artery.
Yep. The wrist or through the arm in here. I guess it just depends on how old you are, what how damaged your arteries are.
If you're an addict, like your artery, your shit's going to be blown out on your arm.
Yeah,
sure.
right. So they went through the wrist, and actually you can see that right there. See that little hole?
Yeah, and you need to be careful with that fucking wrist.
Yes, I do. Well, now we're like 5 days or 4 days.
But still, I don't want my boy. I don't want my boy to die.
Nope, it's all good.
I mean, that's your right hand. I'm sure that's what you stroke with. So
I don't stroke, dog. I get stroked.
Let the record show. I don't know. I can't confirm nor deny what Ken's saying right now.
Yeah. So
I hope he does. I hope he doesn't get stroke, or I hope he doesn't stroke. But
I hope I don't stroke out. Is what you're saying?
Well, that's that, and I want you to have the ability to stroke. You know what I mean? I don't want you to lose that.
Yeah. It's a dominance thing, being able to stroke. Depending where you are.
Depending on the situation, yeah. If I was, hovering over you, yeah. For a dominance thing, yeah. I could see it.
Sure. So anyway, we'll go into this detail here a little bit, right? So I get in there, and the poor nurse, because I'm being told by everybody they're doing the groin insertion. I don't care. I really don't at this point. So
just fucking fix my shit up, please.
Get in there and give me the drugs to be fine.
Well,
but they there's got to shave you and all that. And I was like, well, you know what? Like, I want to save this poor nurse.
My asshole is already waxed and bleached.
Oh, yeah.
So, that was
I did like a turtle shell.
Path of least resistance.
I cleaned myself up like everywhere around here.
Like
bald.
Frank in that episode of Always Sunny.
Oh, yeah. Which I felt bad. I don't want these nurses to fondle my junk and try and shave around there. It's their job. I get it.
I was going to say, dude, they've seen hogs like mine. They've seen Pico hogs like yours. It's nothing that they haven't seen or dealt with. You know what I mean?
So I told the nurse, I was like, I got it all taken care of. I was trying to think of you. And she's like, we're going in through your wrist. And I'm like, what the fuck? So I turned this into a barren wasteland and didn't even go in down there.
He went full Hiroshima on that fucking.
Oh yeah, wiped it out. And then they're like, nah, we're gonna go through the wrist. I'm like, okay.
Well, at least check it out down there, because I did some stuff for you.
Yeah, right. You know what?
He's got flames cut into his pubes, is what Jacqueline told me.
Yeah.
It's
Guy Fury.
Guy Fury.
Yeah.
He's taking you to Flavor Town.
Oh, for sure.
But it's like a heart attack, though. Sure. It's like a heart attack grill.
That's really what it is. Yeah.
Maybe you should sue them, because you went to eat there the other day.
Yeah.
Right before you allegedly had this heart attack.
That's probably what it is. The more that I think about it,
it sounds like they're liable for this. To me, we could settle for $250,000. I think it's fair.
And I'll take one last quadruple bypass burger, please, because
just for old time's sake. Yeah. I don't want to be that guy that sues you and then doesn't come back. Like,
yeah,
we'll be brand ambassadors.
Oh, sure.
They'll sponsor the podcast. Like, it's a tomato situation, and no crying over spilled milk.
Nope, not at all. So anyways,
send us that agreement in the mail with the check.
Yeah,
we'll talk.
We'll get it figured out. After this, after I've been shaved right in the arm now, because that's where they're going in. I sit and wait. We're waiting for my time to go back. I'm already hooked up to the IV cath, and all that stuff. And
did you piss through the catheter?
No, so.
or
common misconception, because there's multiple different kinds of caths. Like a urinary cath.
Yeah.
This is a like your IV cath.
Yeah.
So good. And then they used a
when you say catheter, that's immediately what my mind.
That's what everyone goes to, because but there's caths for everything, right? Anytime you're going through something,
you have to. You don't have to explain it. I don't.
So I'm just waiting. Like, I just need you to give me these drugs and knock me out, because I do not want to be a part of this. Just do what you got to do and wake me up in recovery, Well, they're like, yeah, we don't really put you out. And
I was going to say, you're not going to be, that's not a procedure that they're going to completely,
right?
They're going to local anesthesia and then minor, like they're not going to totally wipe you out.
Right. Because
you can die.
You can die.
Yes. That's what people don't understand about getting put under with anesthesia. Like, you can, every time it's a risk.
And they're tickling my heart at the same time, so they can't do it.
Not like me.
Yeah. We didn't talk about the whole procedure, but we're getting to it here. But I found out, you get back in there, they give you basically fentanyl, right? Like low dose fentanyl. That's what it is. At least that came in on the docs.
It is. Yeah. Well, you better check your billing.
Oh yeah, I check all that shit.
No, your out of pocket's gone. It doesn't matter.
Yeah, but I check it all. But anyway, they give you that, and I was awake the whole time.
They gave you the COVID vaccine, the new booster, right?
Yeah, this probably would cause my problems. The fucking having COVID.
It's possible.
Who knows, man?
I
doubt it. I highly doubt it.
We can't. I mean, to be fair, I don't know. I don't know if we ever will, but we'll see. But
who knows?
We got to look. I mean, I think we should.
Well, I got COVID. We should
look at it.
4 years ago. Okay.
I feel like I don't know if I had it.
All of a sudden, having heart problems 4 years later, like 70% blockage. I was a strong young mule. Just 4 years
you're
ago.
So weak.
You're so weak. You're so weak.
Yeah, it was more of like, there's a term for it. I can't. It's not coming to my mind right now.
I don't know. I'm not familiar. So
I'll drink to that, though.
I will drink to that too. I'm doing a lot of these. Just nice to be able to do that with my boy.
Hey, I'm so glad you're not dead, dude. Mm-hmm. God forbid I had to do this podcast with, like,
terrible
John or something.
Oh, terrible. It'd be awful.
Well, it would. I mean, we would.
It'd actually be fun.
We would succeed, but wouldn't be the same.
No,
I'd have your picture up there in like one of those real, like, Kim Jong-un style.
Oh, bro, that'd
like
be funny
murals,
as shit. Absolutely.
Like you're up there, and we talk about,
pay homage to me every time.
This one time when we were chipping outside, he hit a perfect game.
That's it.
The first time he ever did it. The first time he ever did it.
Perfect.
Every time.
So I'm back there, and I'm awake, mind you.
Yeah.
And this room's pretty ominous, like all surgical rooms, like anything. There's a lot of equipment, right? There's a lot of things that go on. A big team of people.
Well, go ahead. Sorry.
That's okay. So you're talking a team of 1, 2, 3, about 5 people,
I was
four people.
5, I think, is like a pretty standard
surgery,
depending on the operation.
Sure, yeah. So you got a guy running. You got my bartender that's giving me the fent. Mm. You got the guy my doctor, my cardiologist that's doing the actual procedure. Then you have other people running the X-ray machines, and then handing the assistants, handing the equipment, like that. That
would
stuff.
be like my job. I think I'd do. I think I'd thrive.
Sure. So sitting on the table, real narrow table, tall. They have this TV in there. It's huge, man.
And I was going to say, did they give you music or anything to listen to or anything?
Well, they had music on at first, dude. And they had like all these 90s tunes like playing like real loud. And I'm up on the table. And I'm like it's not helping, man. Like, it's just, I'm fucking freaked out, as it is. Like, I don't want to listen to this junk, but.
What are you going to hear? Oh, he's really fucked.
Yeah.
Oh, shit.
It didn't matter. I was, like I said, I was with it the whole time. He's right next to my ear. But he's
probably like kissing you a little bit on the neck and like biting your ear a little bit.
He kissed my heart, dude, with this fucking cath.
I hope he did.
If you're looking probably about like a 6-foot long screen, by about 4 foot tall, very big screen. Like half of it was vitals, right?
Yeah,
the other
half was image.
Yeah, right. Yeah. So, and I was like, is it cool if I like kind of look? I was like, I wanted to see what was going on. It was crazy as fuck. And he's like, man, do what you want to do.
It was weird as shit.
Yeah, and he's like, if you can stay awake, and I was like, dog, Okay.
Give me a little more Finn.
Most people, yeah, right.
Give me a little more.
Let's
have it a little more.
And it's funny. I do remember one bit he had in there that had everybody laughing. So this is really cool. This is towards the end of the procedure. Mm-hmm. But anyway, so he started going in and doing his thing, and it didn't hurt. Local anesthesia, hell, it hurt going in. But
the initial push.
But he told me, hey, your arteries don't have nerve endings on the inside of the arteries, so you're not going to feel this. You'll feel it at the heart, right? You're going to feel it insert. And he's right. I mean, fucker was in there fast, And I'm looking over there and I'm like watching the screen, see what's going on. You can watch my heart like doing like the vessels.
Yeah,
and at the same time,
contracting.
They're injecting contrast and they're doing imaging with the CT or X-ray, whatever it is, while they're doing everything so they can see at the same time.
I bet. So the visual is, I think they're monitoring the blockage on the CT is my guess.
They're monitoring just the arteries. They don't see anything else but the arteries. That's all I saw on the screen. It looked like weird.
Could you see the blockage in that or no?
Yeah. So I'll get to that.
Yeah. Go ahead.
So they did the procedure.
I feel like that's your baseline, like overall map.
It is. Yeah.
Of what's happening.
Crazy. Yeah. So once they found it and they confirmed it 70%. And I heard them talking about that and they said, okay, so from here.
Yeah, they could at least not fucking try to scare the shit out of me when you're poking my fucking heart.
It's all good. Yeah, it's all good, man.
Get the vent coming, dude.
So they pull the cath out again, right? Yeah. Then they put it back in. They do it 2 more times. And I'll tell you how this works. So they put it in next with the angioplasty. So it's real tiny. It's a little balloon, right? So what it does is goes into the affected artery. It blows it up. What that does is smash all the plaque and calcified everything and smash it, opens the artery back up. First of all, to stop you, this was terrible. This was giving me a heart attack.
So not to get off topic, but I know when we initially talked about this, how calcified was the blockage that they could assess.
I didn't get that information.
Okay. Well, they put the stent in, so go ahead.
Yeah. We'll see. We'll make a determination. Maybe it'll answer your question towards the end of this. But so they're physically giving you a heart attack twice here because they're
stopping
100%
all the flow to that.
Bro, that was when I even on the Fen, I was like, holy shit. I was like, he's like, yeah, it probably hurts slow. And he says, remember how this feels. That's what he said. He said, remember.
You're having a heart attack.
Yeah. He's like, dead ass. That's what he said.
So it's crazy because I know people that I've worked with that are like, they've had heart attacks when they're driving from work and they're just like, man, just gonna keep driving, just gonna keep going home.
How could you do that? Like what I felt though, I was like, how could you do that?
Some people, I think it's one of those things like you might just be like, man, it's probably
it'll go away.
It's probably nothing.
Yeah, until it doesn't.
We'll tell you till you're dead.
Right. Oh, fuck. So they pull after they do the angioplasty with the balloon, they pull it back out, right? Yeah. Then they put the stent on the cath, the balloon again. They put it back in. They blow it up one more time. So this thing looks like a little wire mesh.
Yeah, it's a little lattice essentially.
Yeah, and it's impregnated with some anti-rejection drugs and some things like that.
I bet it's coated in silver. No fucking joke.
Maybe.
I guarantee it.
Yeah.
From a medical, it's the most medically patented material there is.
Yeah, I mean, I don't know.
Most patented material, silver.
Yeah.
If you guys didn't know that.
But I don't know. I don't have the answer to that question.
No. That's a fact. But I'm saying it probably something
along the lines.
Yeah.
But so they go and do that one more time. Hurts like fuck again, and then they're watching, monitoring the success, whatever they talk about.
Well,
in the room.
I'm sure they can measure the flow, or they can view the flow as you're sitting there. And be like, oh damn,
they're watching it. Yeah. Near zero is what I'm at as far as blockage. Near zero. Yeah, it's not. It's obviously not.
You're probably in the 97 to 99%.
Yeah, that's what I would say. So now I was like, hey, I was still there, and they got to keep you there because you're losing blood. Like, there's nothing you can do because they're in your major artery, and they're trying to do their best.
They just have to stop you from bleeding out enough
to finish the procedure. Yeah. Mm-hmm. It's like finger in the dike. You just gotta,
It's modern medicine. It's kind of amazing, and people, I don't know. We'll talk about this.
Yeah.
I think we should really brush up on our medical skills, but we'll
probably should.
We'll talk about it.
I need to now, but either way. So I was like, hey, can you show me the before and after imaging, just like side by side in that screen? They're like, fuck yeah, we'll bring it up, and they were like, Well, the other guys were like all kind of like mags. They kind of, I think they wanted to like finish up and quit or whatever.
Yeah. But
and they're like, he's gonna forget anyways. And my doctor's like, no, he ain't, man. Like, it's like we get a bunch of old people in
that's
here.
That's what
like,
I'm saying. Well, go ahead.
No, it's like all we get is old people in here that don't care and won't remember. It's like we'll show them. Then everyone's like kind of laughing about it, and it was pretty cool. And I saw it, and I was like, man, like he's like, well, here's this and this and show. And I was like, holy fuck, like that's significant. Like, it was, and it's about actual size, probably about this long.
70% blockage, like to 90%. Like that's a huge.
It's noticeable.
It's a huge difference, dude.
So get out of there. Wheel you back. I'm BSing with the ladies.
Excuse me, 30 to 90%.
Yeah, I knew what you meant.
If it was 70% blocked.
I knew what you meant.
Math, you know what I mean?
Yeah.
I do it every day. Don't fuck.
I was going to brush past it. Don't let the listeners call you out.
Fuck them, dude. They can suck my cock.
So they put this cool thing on your wrist where the insertion site, you can see the little hole right there. But
yeah, don't act hard, dude. With that sleeve. Don't act hard, dude.
Yeah. It's like a clear thing they fill up with air. It's super, super tight. It's almost like a tourniquet, but not, right?
Yeah.
It's right on this site where they go in. And then you have to stay in the hospital for hours because this is a major artery. They got to make sure.
You.
Yeah. And I'm on blood thinners instantly as soon as I get out of there because if you don't, this
clog right
fail. Oh man, your body wants to not have a foreign body in it. You have to take this.
Your body's not used to what's happening right now.
Not at all. No, and it's traumatized to have something in there. It's trying to reject it, and they're getting platelets that are getting
gaped out like that, and just
doesn't want it. Nothing wants to be gaped out.
Not me.
Take that as a lesson.
Not me. For the record,
your body doesn't want to be gaped, but
my body doesn't want to.
Mine doesn't either.
Well,
my artery wanted to be.
It was. I was going to say it was. I mean,
so this thing
not brushed past it here.
You put on there. And it's they'll slowly let out air, right?
Yeah.
And then after they get to that certain point and you're cleared to leave, you still have to be super careful, right?
Oh well, because if they rip that thing out and they tear that artery, like
done. Well, they did. They took too much air out first.
Well, I was gonna say I'm sure there's it depends on
it is, person,
yeah. But
a little too much air out, and the fucker went. Like I was out there in the room and it was like, I was like, holy shit, dude. Like that's a lot of blood. And it comes out fast, dude, out of an artery.
Oh, yeah.
And they were like, no big deal. It's just like, we took a little air, pump a little more back in there. We'll leave you here. And they were trying to clean it up. Cause like, we need to see if it's bleeding. I'm like,
find out where stop the bleeding and then find out where, because that's the other thing is they're pretty much in control of the situation.
Yeah.
You know what I mean? You're in the operating room. It's not like you're not going to die.
Right. And well, there's always that chance that you're saying, dying on the table, but not my age usually.
That's what I'm saying. You're young enough that like,
yeah. My report's saying blood loss of the whole procedure is 30 cc's, which is actually very little if that's the case.
Yeah. Well, so people don't understand is like the human body has a lot of blood in it.
Oh yeah. Mm-hmm.
It's a lot of blood. People like will look at crime scenes or things where there's like, bro, you could spill a gallon of blood.
It travels far and it looks like
it really spreads. And the person's standing up, walking around fine.
Yeah.
No big deal. But then, bro, there's a little bit of blood and somebody's dead as fuck.
Oh yeah, absolutely.
Sitting there on the ground like on a dirt nap.
Crazy.
You know what I mean?
Like,
It's all
different. Now 30
cc's
depends,
man.
It's kind of probably like if you were to think about like a little syringe. I would say it's probably like
I'd say 4 to 6 ounces, give or take.
I don't know the conversion, but yeah, maybe that's
liquid ounces.
That maybe right. You can fact check us.
I don't know. I don't know, man. I'm not a doctor. Yep. I'm not a physicist.
So basically, at the end of this, they give you a binder, everything, how to live your life now. Life's different. I'm just gonna be honest with you. Life's different. I can't party like I used to. It's okay. It's okay. I mean,
no, we're gonna get you fit and finish.
Yeah.
And then we'll ease back into what we can do.
That's all.
What you can do, and then I'll go a little past it because
of course.
I also have to get checked out now. Thanks, dude.
Yeah, you're welcome.
It's funny you say that. Thank you for that.
So all my boys that called me and even family and whatnot, they call and they're like, hey man, I'm so glad you're okay. It's so fucked up. It's crazy. You're so young. Like you're lucky. And really at the end of the day, I am very lucky.
That's how I knew you were going to be okay. Like, bro, if they caught it early enough, like you're young.
Yeah.
We're going to be able to move past this.
Yeah.
You know?
But everyone calls the first thing after they're asking about, they're like, so, what
were you feeling?
Yeah, what made you? Because I kind of. Everyone's all of a sudden having sympathy pains. Everyone's like, they're all feeling the same thing. They're all like, ooh, like I just, maybe it's me. Maybe it's like, maybe I got to go do that, dude. But really, at the end of the day, I will assure you in one thing that I would bet that hereditary genetics or whatever played more role in this than anything else. However, lifestyle plays a huge factor. So this was a combination for me, but I'm telling you, like my dad has coronary artery disease, other, AFib, other heart diseases.
So we discussed this off air, but I think in your situation, it's probably at least I think highest 50-50 genetics lifestyle. Mm-hmm. Any 50-50 to 70-30 genetics lifestyle. Yeah. Lifestyle being 30%.
Right. So
that's sort of my estimate, because hereditary, it's a big deal. People don't understand.
It's a huge deal.
But that's also part of, if you could change. The other thing is, like, if you change your diet or change, like, you can eliminate or reverse or at least halt some of those factors. Now, they say that as far as a couple doctors I've heard from that will say that genetics play about a 60-40. So you're not too far off. So 60% genetics, 40% intervention or like lifestyle, right? So it doesn't matter what you do, 60%, your genetics are always going to outweigh some of your lifestyle, right? So you have to try harder with the lifestyle if you have a known genetic issue. It's just
nice touch on that sticker too.
Well, it was sitting on my chest, and I forgot your daughter had given it to me. You know what I mean? But I think you're going to be fine.
Oh yeah,
it's more of just you have to make a lifestyle adjustment,
of course,
change it out, and I think you're going to get to a point where you'll find a sustainable level.
Absolutely, yeah.
You know, just like anything,
I'm okay with it too. And that's the thing. I was kind of broke up at first because all this stuff was an extreme abrupt change, and anything that's abrupt it's really hard on your mind and your brain.
People, you can say you like change, but it's the human body really, I think, thrives on a schedule, routine. Mm-hmm. Like, and you throw a wrench into that, you're gonna fuck yourself up a little bit.
Yeah.
But you have to do it.
And here now I have an ultimatum, right? So it's a little easier knowing that I have an ultimatum. Basically, the doctor said,
you are retarded.
And if you don't change anything, then you're going to die.
Don't say that, because then, like I said, I'm going to have to go get checked out now. Thanks. I feel fine, but
Yeah, so did I. Kind of.
That's the
kind
thing.
of.
Like, I don't know.
It's all good, dude. Everything's fine. The PSA I will say is that when it comes to cardiovascular health, if there's something that you feel, your body better than anybody else does. If something feels different, just have it checked out. If something feels different, that's it. I'm not saying you need to be having chest pains to go, because I didn't. But something wasn't right, man. That's all I got to say.
See something, say something.
That's all. Yeah. Basically, don't
trust your body. If you don't feel right, something's probably not right.
Yeah, don't ask, don't tell. Like it's all those sort of things.
That's my policy with you, because I know, and I don't want to know. I don't want to know officially on paper. Yeah,
don't tell me.
I don't know, man. I'm just glad you're here.
Thank you.
Like I said,
me too.
I wasn't
for my kiddo. For my wife.
I was concerned. I was concerned about it, but you're young, and they caught it early enough that I was like, you're going to be fine. Mm-hmm. But it's more of just like, it's just my boy. Like, in that situation, like, I don't like it.
They only make one of me. You know what I mean? Be a hard time to find another one.
Your brother's gone. Like, I can't. It's how am I gonna? I could get, if Damon was here, he would be he would be a replacement. Let's just.
He would have to be. Yeah.
I want to say it for the record.
He would have to be. Yeah.
Because we really. He would have loved the podcast, dude.
Absolutely. Yeah, I mean, he would have been on it already multiple times. Yeah, and this is probably hard on my parents too, because after my brother dying, and then the scare and the closeness, how close that I would potentially got to dying, just it's not good for our household,
Yeah, but like I said, it's that, thank God.
Absolutely. Yeah.
So I like to think, I mean, I believe in God.
Yeah, I do.
A higher power.
Yeah.
And there's a reason why I think everybody's here on earth. Everybody has a purpose. What that is I think you make your own luck a little bit, but
sure.
I think things are laid out in a way that,
all I'm saying,
things happen for a reason.
Yeah, I agree. And this is a perfect example of that, because like I said, dog, this was not typical of any average person. Any average person to go
I mean,
do
you're
anything about it. I
above
think.
average in some respects and way below in others.
And weight. It's been fucking in obesity or body mass.
I was talking more of length and girth, but yeah.
Sure. But the point I'm trying to make is that the average person, I don't think would have went and did anything with this.
No,
I don't think so.
Well, like I said,
So divine intervention is what I'm driving at.
absolutely, but also, so not to get off the God topic, but
Yeah.
you had health insurance, because otherwise this would have been probably, I would say $250K, $300K.
Say goodbye to the studio.
No, I'll buy it. I'll take that off your hands.
Thank
dude.
God.
I'll take
At
it
least
off
I
your
have
hands.
you. Yeah.
I got a little bit of capital, I'm doing okay in life. Like, how I can't complain, the cards I've been dealt, I would not shuffle the deck again.
Yeah, even me, I probably wouldn't.
No,
even
why
even
would
with
you?
my health issue right now, I still probably wouldn't.
We are so lucky in the grand scheme of things.
Yeah.
Like, I don't want people to think we're not appreciative of the lifestyle that we are privileged to live.
Yeah. Let it be known that, we do not take our lifestyle for granted. However,
Sometimes we do.
I take my health for granted. And I will
Like I said,
admit that. But
Sometimes we do.
yes. But as far as, we're blessed to have some of the incomes that we do, even though they're not like, we're not rich by any stretch
No,
of
but
imagination.
we're okay. Like, we're not going to go broke tomorrow. Like, we have, I mean, I don't know. I think we both have fuck you money where
A little bit. Yeah.
if tomorrow you had to say, yeah, fuck you, I'm quitting my job, we could do that and find another one and be okay.
I could do that. Yeah. I could do that. Yeah. I would have to move kind of quick, but I could do it.
Yeah, but your job is so in demand.
It is. Yeah. I can get a job pretty quick.
So, well, I don't know, man. What would you, sometimes I think about this, like if I left my job, or like shit would just break. Like, shit would just not work.
Yeah. Just fucking whatever. Fuck you. They tried to call me today.
Oh, fuck, dude. You were saying that earlier. I was like, yeah, you
Cocksuckers.
can tell them to fucking suck my cock.
I literally had a near-death experience, and I think you can actually say that.
You had essentially a medically induced heart attack. Like, I'm going to be taking it easy up until, like,
give me 1 week. That's all. The doctors.
You should take 2 weeks, I think, is fair. Like, for what happened,
Yeah, and probably
it's not even that. It's
the mental processing too is getting me to a new diet and a new lifestyle.
Well, but that's not. Just don't be a bitch, dude.
No, you're right.
You've done it before. You'll do it again.
But it is helping being home for a week to change some of those things.
Absolutely, it eases the burden of doing it, or the stress of doing it. Yeah, because that's the other thing. So. I mean, we didn't really get into it, but lifestyle change. Now you have to change how you live your life.
Yeah,
now,
right.
At least for, I think, the next couple of years, until you get a baseline.
At least for 1 year, right? So I'm on a blood thinner for
how
year.
long? A year.
1 year, but I'm on baby aspirin with that blood thinner.
So
and baby aspirin for the rest of my life.
What we were joking about
Daily.
What we were joking about earlier is that you drank so much booze every day that it thinned your blood out enough to where that 70% blockage wasn't really a factor.
And I kind of believe it. I think it saved my life.
I honestly, if we're talking about, because 70% blockage,
you're in heart attack realm.
You get up into that range. It takes some time to build up, but like, I don't know, man. You could have been gone.
Oh yeah,
and
what if I would have quit drinking and all of a sudden my blood would have just stuck together, man, clotted
Thank God you didn't stop.
Thank God.
I mean, it's like,
but anyways,
I'm not going to make the comparison, but yeah, thank God.
It's all good.
Yeah.
But I don't want to get too derailed. I was saying, work tried to call and they were like, wow, we hope you're doing well. While you're home, if you're bored, can you research a couple things, help the shop out a little bit?
Yeah, I won't, but yeah.
Yeah.
Cool. That's cool.
That is one of the most offensive things you could ever ask me. Like, help the shop while you're at home. Go fuck yourself.
So this is my own personal opinion, and I think this matters in life. And if somebody's on vacation or something, if I have to ask you a question, I'm going to say, hey, I apologize for bugging you. You don't have to answer this right now, but if you find the time, could you let me know X, Y, Z? If not, fine, we'll be okay.
Like super apologetic. Like,
that's what
hey,
I'm saying.
man.
I'm sorry to have to contact you on your time off because I shouldn't be contacting you.
I just had surgery. I'm hanging out with my family recovering, but
you could have died.
Yeah.
But I'm gonna ask you to, man, could you kind of do something for me? Because I'm lazy as fuck. I'm some dumb fucking boomer who doesn't do shit.
Yeah.
You know, like, yeah, I don't think so, Guy.
I think my time there is.
No, get whatever. Well, the other thing is, I mean, you want to do a corporate takeover, a hostile takeover, we could do it.
Yeah.
You know,
Thought about it.
I'm telling you, I could cut the fat around there. We could be operating, we could get a much better margin.
I think so.
Much better margin. I'm talking 10, 15, maybe 20 points.
Be a good raise for me.
Excuse me, 200 points.
Oh.
But that's bare minimum, because we're going to cut the fat. We're going to have to do a little bit extra work, but we're going to get paid more naturally.
Well, yeah. So nothing will change. We're just going to get paid more.
Well, no, things are going to change.
For them.
It's going to get a lot easier for us. And maybe it's going to cost them a little more money, but that's irrelevant. You know, in the grand scheme of things, you got to spend money to make money. Everybody knows that.
It's the golden rule.
That's a universal, thing.
Man. So here I am, man. The biggest things, I talked to the doctor too, and this should go for everybody, right? Especially for me.
Preach some advice or
Sure.
What people should do.
So, biggest thing right now is, I'm also on statin too, so that's for cholesterol, but keep your transgender fats 0, right?
Yeah, sometimes sometimes I just tear into them and they infect me.
Only the F to M's.
Well, sometimes I go A to M.
With the F to M?
With the F to M. And then it's a botch job.
Disgusting.
Honestly. It's a real, I don't want to talk about it.
No. But anyways, in all seriousness, trans fats, limit to 0. Saturated fats, limit to 0. Cholesterol, try to limit as much as possible. Sodium, limit as much as possible. That's the biggest things, man. Everything else will fall into the line, know?
I feel like that's all mostly blood pressure related and cholesterol to some degree, but dietary cholesterol and blood cholesterol there's hotly debated studies about
certainly
what influences what and what's right.
No, you're right. And the thing is,
I'm just saying, I don't know.
For,
and everybody,
for me,
the thing is,
everyone's different. How they process it, your body processes it.
You're Slavic in nature.
Yeah.
I'm like Anglo Northern European in nature.
Yeah.
Our bodies, they don't operate exactly the same.
They do not, no.
And it's not
genetically.
It's nothing you can do about it. It's just who you are.
All they do know is that, here's what happened. You have a buildup in this artery. This is what causes buildup for most people. And here's a medication that stops that buildup, which is the statin, right? So that statin, in combination with dietary change to those saturated and trans fats, mainly, right? Mm-hmm. That stops the buildup. The sodium is blood pressure related. You want to mitigate, or I guess keep under control, blood pressure with a statin, at least for the first 6 months, a year.
Yeah.
Because you don't want anything to happen as far as too much pressure with it.
Misplacement or
dislodging. Yeah, something. Yeah. But that's the most dangerous thing right now is 6 months to a year. The biggest failures in stents is because people are fucking up their diet or their medications. Mm-hmm. Like they're 100% life saving and necessity right now.
Yeah, when you have that operation or need to have that operation, you have to. There's recovery involved.
Yeah,
and you have to. I mean, I personally would go by the doctor's orders,
and I am. That's the only thing I know right now. I mean, there's other things. If I didn't have this shit in my body, that I might have suggestions. But guess what? I'm doing what he says because he's got a good track record, right? And I'm young.
Hopefully.
Yeah. And I don't want to be on these medications, man. I don't want to be on thinners and statins, but I'm going to be on a statin for the rest of my life, most likely. And I'll be on baby aspirin daily for the rest of my life, most likely.
So this is my guess, because we're we feed off each other. We do things.
Yeah.
I think 5 years, you're going to be at a level where...
Try and take them off, see what happens.
Not even take them off, but you're going to be like, I probably don't need this. I think you're naturally going to be like, yeah, I don't think I need this.
Maybe.
But it's I'm not gonna tell you what to do, but that's just my if I'm a betting man.
Yeah,
right?
it's all going to be blood work,
Yeah.
right? So it's going to be consulting with a doctor, and we get to a certain point, be like, hey man, do you think can we try and lower dosage on this, and let's do blood work again in 6 months, and let's see, does my cholesterol change? If it doesn't, then you can say, oh boy, let's start taking away some more statins. See what I'm saying? As long as you maintain that lifestyle.
That's the thing, is it's going to be a trial and error in what your blood work really says.
Correct. Yeah.
I think is really what will eventually happen there.
And it's just like me working on airplanes, man. Like sometimes you gotta test some stuff, right? You gotta, hey, let's give this at this angle on this degree or flap or whatever, and then go fly this, come back, let me know how it did, like make a little adjustments. You're adjusting because you can't be there live to adjust it on the fly. No pun intended, I guess. So you just gotta play with some stuff till it comes back.
People say the definition of insanity is doing the same thing over and over again and expecting a different result. So if you want a different result than what you had, which was
dying,
almost dying, then yeah, you should probably do something else, and you will. It's
simple as
you're not a fucking invalid.
No, I am young enough, like you said. And the other thing though that I just doesn't sit well with me, I will say though, is that I am this young. See what I'm saying?
Yeah, but like I said, you're genetically predisposed also to some position. Like I don't think of it as I don't think it's this young should be. My opinion. I'm not a doctor, but it's a positive on this because your body is young enough to. You're not like it's not like you're 60, 70 years old. So when we initially talked about this, you were like, yeah, they tell me that people with a stent have, like, generally speaking, statistically lower life expectancy.
Generally, yeah.
And I'm like, yeah, but that's the average fucking retarded boomer.
Yep.
Who is not going to change their ways. They're going to get...
Also, they're getting them in their 60s where they're never going to change.
Well, that's what I'm saying. They get this procedure done, and they're not going to change.
Why would they?
They're going to go back... Like I said, I think, statistically speaking, you're going to be fine.
Wait, I mean, inshallah.
Yeah. But,
I mean, we'll just see, man. That's all I can do. I'd be happy. I know it sounds a little light, but I'd be happy to make it into my 60s, because right now I almost died at 36. So understand that 60s would be awesome.
I don't want to call it. I don't want to be that guy to call it on the podcast.
Call it right here. It's hard facts. Yeah.
I think you're going to make it to at least 76 to 86 in that range. I think that's easily attainable.
Wow.
If you change, you could do the hundo, you could do the ton. I think that's my goal. My dad. So my dad listens to the podcast, and he wants to be.
Shout out, man.
He wants to be on the podcast.
Absolutely. Is it call in, or does he want to be in live?
We'll have him call in, or we'll do. I don't know. He could do both, but we'll see. We'll see. But
George wants to be on too. Real bad.
We have to get
get him on.
I think we have to get them both on.
George is my dad. For anybody that doesn't know. Good guy. He's got some stents too. He's doing actually pretty well. So,
like I said, it's you're genetically predisposed, but what was I saying? Fuck.
Well, talking about your dad listening to the podcast.
Yeah.
Listening in and talking about.
I was going somewhere with it. My dad's goal. So I think he wants to live over 100 years. That's his goal. So he's done a couple different things. Like he's gone like no meat, like pescatarian, except like only fish, like stuff like that.
Guess what? That's the diet I'm basically on right now. Very little meat.
You have to watch your fat intake, quote unquote.
Yep.
But I also think that could be a genetic thing for you. But you have to do what you have to do, and you can easily live like that. It's not like giving up a certain food. Like don't be a fat piece of shit.
Yeah, no, that's definite right there.
Like you can still eat, like, but yeah, you just can't eat certain foods.
And you can't don't gorge yourself, amounts. Man. Like there would be times I remember I still
do it all the time.
I know
it's.
But bro, listen, there's been times where I got real drunk. And I would eat a box of White Castle sliders.
No,
you know what I'm saying?
No, because we don't have White Castles around here.
No, the frozen ones.
Well, maybe.
I'm just saying.
Myth plausible.
Oh, it's fact. And like, I know, like you're talking about sodium content, transgendered fats, like all those things.
Well, I mean, you're basically getting fucking top to the to the brim right there.
I could probably got 2% blockage alone from one of those 36 packs that I crushed.
I think one night you could at least do 0.25% one night. I think you could do that. I've probably done it a couple times.
But that stuff, remember, if it's not calcified, you have the chance of it
blows it out.
Yeah.
But that's also a stroke waiting to happen.
Yeah, that is true.
You know
potentially.
I mean?
Potentially, yeah.
People don't understand, like,
not if you're drinking.
Plaque buildup. Well, yeah, but plaque buildup in your circulatory system, it's not good.
No, it's not. It's one of the worst.
In any capacity, it's
one of the worst.
It's not good, you know.
Oh, my.
I don't know. I feel like my genetic background predisposed to alcoholism. Like, I'll be fine. I do need to get checked. That's the thing is, like, now
get checked out. That's all.
I gotta get checked
Sorry
out.
for that, you know, but just go do it.
Really, it's fuck you, dude.
I know.
Fuck you.
I could just die. You definitely
almost dying and have me. I have to deal with your estate, number one.
Yeah,
and
yeah.
I don't want to scam your wife and your daughter, but I'm gonna have to get mine.
Of course, yeah. Get your nut.
Not physically.
From my wife and my daughter.
Monetarily speaking, no. For the record, monetary nut. You know, but like I said, it'll be fine. It'll be fine.
Oh,
I'm just glad to have you around, man. Like I said, it's family and friends are the most important fucking thing in the world. That, like, anybody out there, if you're lacking in any of those departments, do something about it. Like,
yeah, do something.
Make the effort.
Fucking do something.
Don't be that guy that, like, I'm just gonna ignore my problems and not do anything about it. Like, that's a real weak bitch ass response to life in the world.
People
like,
depend on you. That's all I'm saying.
Somebody does. Like, that's the thing is, like, I think so. You're a father. I'm a godfather, I guess. Technically.
Yeah. We'll call it that.
You know, and I mean, I have a hog, so, like, yeah, you know, I mean, I eat.
Your hog depends on you.
I eat cured meats, and I do drink wine on occasion. You know, so I'm basically a godfather. Yeah, I'm a made man, right?
Sure, yeah.
Made in America.
Yeah.
You know, and so, like, you know, it'll be fine. It'll all work out.
I think so.
I don't know.
Yep, I think so. What else, man? What else do you want to know? I'm here. I'm live. I'm kicking. I might have another glass of wine. What do you think about that?
I would say a quarter. I'll give you a quarter glass is the most I'm willing to barter with your life.
Excuse me. Yeah, no, for sure. Blood thinners. I mean, blood thinners, man. Like,
no, but you're my boy. I don't want you to die. Like, that's this whole thing is like, you and me both are no strangers to lifestyle change. And, like, we've gone through rapid phases of our lives where we make significant change.
Pretty quickly too.
Absolutely. Too quickly.
Yeah.
And it's not necessarily good for us, but you learn from it. And I just want my boy to calm down. We'll help him fix his house. We'll fix the line out there. We'll plant your garden for you. And you know, it'll all be good. But, like, I just don't want my boy to, I don't want my boy to die.
Yeah,
because
man.
You're kind of my best friend.
I appreciate that. And likewise.
Well, cut this. We're going to
cut that out. Yeah.
Cut that. But, you know, yeah, you know, you're my boy. You know, like I said, you're young enough. I was concerned, but I was like, he's not going to die. You know what I mean?
Yeah. I mean, I felt that way too, but it kept getting
Oh yeah.
because there's always those chances.
You're getting fed all this information that your body has been working this way for quite some time.
Sure.
Like, that's the thing is, like, your body's accustomed to this. It's not like if you so say you went steady Eddie, yeah, maybe you would have died someday when you got really dehydrated and didn't drink some water and you were working outside. Yeah, you might keel over one day.
Yeah.
But maybe not.
Maybe not.
That's what I'm saying.
Yeah.
I don't know.
It's too hard to tell, you know.
I'm just glad you're here.
Same.
and that they did mitigation. You know what I mean? Like, that's I think the biggest thing is now you know, and it's just a matter of adjusting. We'll make an adjustment and we'll make a tradition out of it.
You can call me Near Zero now.
I like that for a call sign.
As far as blockage, yeah.
Near Zero.
That's right. I like it. Maybe that's what it is.
I mean, I'm Mantis. He's Near Zero.
Yeah.
Or Pathfinder, you know.
I'll take them both.
I like Near Zero, though, dude. That's a good one.
Yeah. Oh, well, I'll tell you what. On that note, everybody, take care of yourselves, man. If something doesn't seem
Seriously.
right, just go fucking do it. I mean, I'm 36 years old, man. I shouldn't even have had to do any of this, but
Never.
I never would have thought, neither did the doctors. So everyone I talked to was like, what the fuck are you doing here, basically? So take care of yourselves. Go out there, man. Be good to your body. Have some fun. Work hard, but play hard. But just be mindful.
I will say 412-613-1116. yinsvoice.com, therealyinsvoice@gmail.com. Check out all of our social media, Snapchat, Instagram, TikTok. And then we have, I think we need to get back to a couple of people because we want some guests on the show. So I think this weekend we're going to have somebody, and then maybe next weekend we're going to try to figure some stuff out. But
yeah, a lot of guests coming up. Just a couple teasers. Bill and Drew, the
intro, outro music, you'll hear
the
them here in a
authors,
second.
beautiful musicians, man. They have some fantastic music, and we'll get to talk to them and dig into their brains and all their talent and where it all comes from. And a couple more photographers and urban explorers from the area.
Artists,
Some artists, yeah. We got some good guys coming on here. Vern eventually is coming back on too. We didn't forget about you, Vern. We just got a lot going on.
We also have, I mean, local celebrity artist, rap artist. I don't want to say his name yet.
Don't say it yet.
But
yeah,
we're gonna have him on. It'll be, honestly, I think we're gonna produce a song with him.
that's the goal. Now that I'm alive,
I think now you sort of, I mean, you have to follow some creative outlet.
got to do something. You will not be. I guess I'll be surprised by the amount of hobbies I didn't know I had. Now that I'm not doing stupid stuff, just worrying about eating
don't call drinking.
Well, I'm still gonna
stupid.
drink. I'm just gonna.
Because that's a big part of our brand. Like, I don't want people to think that we're gonna stop
Well, I'm not stopping
cold
drinking.
turkey. Like,
On the show, I'm not stopping anyways.
that's what I'm like. Like I said, I just don't. You know what I mean?
Yeah, don't worry about
we have
that.
a brand to uphold here.
We do. Yep.
And unfortunately, I mean,
Just slow down a little.
I'll drink to it, but
Yeah, I might.
It'll be fine.
I might
It'll
have
be
another
fine.
half during post here.
no, you have a quarter. I'll have another
A
quarter.
quarter during post. All right, folks. Be good.
Should've pulled out, 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 should've pulled out.
Don't tug on our heartstrings like that.